Good evening. I'd like to welcome you to the Life Church located here in Atlanta, Georgia. You're viewing a very special two-part series on COVID-19. We're going to be talking about the coronavirus, this new virus that has caused this international pandemic, which even in our country has taken over 175,000 lives and caused so much sickness, disease, loss of employment, literally affecting everyone. And so we're going to take a moment and we're going to speak about this virus, where it originated from, the effect that it has on our bodies, how we can protect ourselves, and also introducing you to several survivors. Here at the Life Church, we have several people who have been infected by the coronavirus, but all of them are survivors. And we are so grateful for the fact that they have survived. And they're going to be telling their own individual stories. What you'll find is that everyone has a unique story. It's very difficult to find two individuals who've been infected by this virus who had an exact experience. Every experience is different. And that's why we're going to bring these survivors to you and let them tell you their stories. I want to talk about the medical aspects of this disease as well as the psychological effects. Not only does it affect our bodies, but it has a tremendous effect on our mental health in so many ways. Those who are infected, those who are not infected, as well as the loved ones of those who have become infected. And so we want to talk about all of this, and we're going to be talking about it from a faith perspective. The medical experts, they are saved, spirit-filled clinicians, and all of the survivors are also saved and they're spirit-filled. And so you're going to hear all of this from a faith perspective. And so again, I thank you for tuning in. I know this is going to bless you. It's going to be highly informative, and you want to take an opportunity to invite someone, let someone know that they need to tune in. And you can do us a tremendous favor by liking and sharing this to your personal timeline. This will allow someone you know to get access to this information. It will give someone hope, and it will be a warning to some to take every precaution that's available to ensure that they and their families stay safe. Again, God bless you. Thank you for tuning in. Now, let's go into tonight's session. This is our Wednesday night virtual gathering, and tonight is a special night because we'll be having COVID conversations. Yes, tonight we'll be talking about COVID-19 from a medical, from a psychological, and yes, even from a faith perspective. We even have COVID survivors who will be giving their own personal experience with COVID-19. This night, I believe, is going to bless you and your family, because I believe this is a discussion that is needed, and many of you have been waiting for it to be had. And we're going to have that conversation on tonight. There's so much misinformation that's out there, so many who still do not believe that this is something that we should be concerned about. And unfortunately, a lot of that misinformation is in the faith community. A lot of persons are yet believing that we are somehow protected from this virus because of our faith. And tonight, we want you to know that yes, this virus is real, and all of our bodies are vulnerable to this virus. And so tonight, because of that, we've come to have this needed conversation. As of today, over 5.5 million persons have been infected by this virus. And unfortunately, that number, as high as it is not the real number. This is only those persons who their infection has been proven with the test. Many persons who have been infected and who are currently infected are not even aware. And so most experts believe that we are looking at a number that is anywhere from 8 to 10 times the number that I just quoted. Not only are we talking about over 5 million infections, but we have lost 175,000 American lives. And I want to say that slowly so that we can get the full impact, because unfortunately this has become just a number. But we're not just talking about numbers. These are not dollars. These are not even jobs. We're talking about human lives. Persons who were here at the beginning of this year who are no longer here. Families that have been devastated by the loss of their precious loved ones. 175,000 lives. We've lost more lives this year than in any portion of our history in this nation. Did you hear me? All as a result of the devastation of this virus. If this is not a real virus, I would hate to be around when a real virus does show up and we're in the midst of a real pandemic, if this is not a real one. Yes, 175,000 lives. Unfortunately, Black and brown people are affected even more than others. And so the numbers are even more devastating when we look specifically at the Black and brown communities. We are more likely to be infected, we are more likely to be hospitalized, and we are more likely to die from this virus. Coronaviruses are not new. Unfortunately, the coronavirus 2019, it is new. It is called COVID-19 because this type of coronavirus was discovered in 2019, around December. The first known case was known in Wuhan, China. Many believe that it originated from a wet market, which is really a live animal market where live animals are sold. When you look at the virus genetically, many scientists believe that it originated in a bat and it was transmitted later somehow to a human. And now, here we are, almost 9 months later, and the entire world has now been affected by this coronavirus. So much of what we know about this virus is new, and we know information now because it is a new virus. And so for those persons who don't have a scientific background, that is why sometimes it seems like the information or the recommendations are constantly changing. Many have come to believe that this is not real because we were told one thing 5 months ago and now they're telling us something new. Well, the reason for that is that we are learning as we gather information and data about this virus and persons who are affected by it. So there were things that we thought 6, 7 months ago that we don't think anymore. We don't approach it the same way anymore. There were things that were recommended originally that are not recommended today. That is not because people are being deceptive. That is because our understanding and awareness of this disease is improving each and every day. I know when it first started, they were recommending that we not have, that masks would provide no benefit. We later found out that masks were protective for other persons. So not necessarily for the one wearing the mask, but for those who would come in contact with that individual. Now, new data is showing that even the person wearing the mask may be protecting themselves. Again, because this is a moving target and we are gathering new information every day. That's why it becomes extremely important that we stay informed. I am concerned because our community, we are investing more time and energy on conspiracies than actual facts. And so we've got to be careful that what we are listening to is backed up by science. Hear me tonight. Yes, I am a pastor. I am spirit-filled, but I also have a medical doctorate. I also understand science. And so I want you to know that, that this is, again, not a conspiracy. It's not a hoax. This is a real virus. And the only thing that can help us against it is real science. And so even as you're looking and you hear things and you see articles, be careful where this information is originating from. Make sure that it is real scientific data that's backed up by actual science. We are in a very unusual environment. Everything today has become politicized. unfortunately. Even today, our churches, our faith is even becoming politicized. But I never thought the day would come where science is becoming politicized. I always thought that the CDC, the NIH, the FDA, these were isolated individual institutions that were not politically influenced at all. But today, that is not the case. I spent most of my career in the pharmaceutical industry. So I come tonight with a different perspective. I understand the rigorous process that it takes for a chemical to go through and to end up available in our local pharmacies. That before the FDA will approve a drug, I understand the years and the billions of dollars that are spent to bring a drug to the market. The tests, the studies that must be done, not just any study, not just anyone just popping up saying, I took this and it worked for me. No, that's not how drugs are approved. A randomized, controlled clinical trials that must be done. Large trials where the data is prospective. These studies must be done to ensure us that once a drug comes to the market, one, it works, and two, it will not cause us harm, unnecessary harm, and harm that we're not aware of. And so it becomes important that, again, that we stick to the science. And so now we hear all of these miracle cures that are available. If you drink this, if you eat this, if you take this, this will cure the disease. It'll prevent you from getting the disease. Hear me tonight. There is no FDA-approved treatment or cure for coronavirus. There are medications that hospitals are currently using to decrease morbidity and mortality, but none of them have gone through the rigorous tests that are needed so that it can receive an FDA indication for the treatment of coronavirus. Hear me, your local herbist does not have the cure. There is no vitamin in the health food store that is a cure for this virus. There is no known cure. There is no known proven effective vaccine. So the only thing that we have tonight is that we have to do everything in our power to prevent ourselves from becoming infected by this virus. We've got to do everything in our power. Unfortunately, even after doing everything, some people are still going to become infected. But we can significantly decrease our risk of becoming infected with this virus if we do what the experts are recommending. If we wear masks, if we socially distance ourselves, if we avoid crowds, all of these things, if we maintain our health, if we get our blood pressure and diabetes and all of these other comorbidities or other sicknesses under control, we decrease our chances of having a poor outcome even once if an individual is infected. So tonight, again, our understanding has increased significantly. There's still a lot we still don't know. Even as I gave you that astronomical number as far as the number of persons who've lost their lives, one thing that we never talk about, you never hear on the news, is the other portion of the story. And that's the number of people who have become stricken or become ill as a result of the virus. They didn't die, but their lives have been forever changed because of this virus. There are persons who experience significant sicknesses because of the virus. And there are some people who no longer carry the virus, but they're yet dealing with the effects, the symptoms of the virus, even though the virus is no longer in their bodies. And so, yes, it can kill you, but it also can cause long-lasting illnesses. And we still don't know what the long-term effects. We have no idea what individuals can expect 5, 10, 20 years from now. All of that is a question mark because we just don't know. So tonight, hear me tonight, I want you to do everything to protect yourselves, to protect your families, and please, whatever you do, take this seriously. We are honored tonight that one of my fellow Morehouse brothers, we actually went to Morehouse together. We were in the pre-med program at Morehouse together. We went on to medical school. Dr. Dwight Owens went to SUNY Health Sciences Center in Syracuse, New York. And again, he is a board-certified psychiatrist, Peachtree Psychiatric Services. He's the CEO of and also the CEO of Ask Dr. O. And we're honored he's a part of this ministry, and he's here tonight because, again, another aspect that he's going to talk about is the psychological, the mental effects and the impact that COVID has on individuals psychologically. Dr. Owens?
Thank you, Dr. Mayer. When we think about COVID-19 and from the behavior health aspect, a lot of people, the first response is you begin to think about the hospitalized patients. But there are actually three categories of patients that you have to consider. First is the COVID-19 patient, the one that's hospitalized and the one that never goes to the hospital. That's one category. But then you have to consider the clinicians that treat, those of us in mental health, those of us in internal medicine, those of us that treat COVID-19 patients. Now, if you treat the COVID-19 patient, there are two different issues. You can treat the patients that you know have COVID-19, and then you can treat the patients that you suspect. So the anxiety level of those that you don't know have COVID-19, that's going to be a certain level of anxiety. And those that you're treating with active disease and a high viral load, that's going to be another level of anxiety. Then there's a third categorical type of COVID-19 patient. That's the person who was already with a psychiatric illness, the schizophrenic patient. The schizophrenic patient may not understand what you mean when you say social distancing, washing your hands, or wearing a mask. Those are some of the kinds of things that they may not understand. So when you begin to look at the behavioral aspects, you have to look at something critical as it relates to the type of patients. This disease is a mystery in that when you look at the manifestations, you begin to see something called encephalopathy, or what we call delirium. These patients get disorganized, they get agitated, they get some aggression. And what we found in some studies, a lot of the studies, as Dr. Merritt alluded to, COVID-19, the COVID viruses have been around for a long time. We call them SARS, we call them MERS. So a lot of the data that we have are from 2003 and 2012 and 13, from the previous viruses. But what you'll find is that when the viruses attack, especially the organic brain matter, is that sometimes, Dr. Merritt, you don't even see viruses in the cerebral spinal fluid. So then we began to talk about this inflammatory response that comes with COVID-19. That's another piece. So you see the elevated C-reactive protein. Then there are these interleukins and leukocytes, a number of things that come with this whole response to the body. So this virus is something that has a great impact on the neurobiology of the body. And when I say anything that's brain disease, organicity. So when you hear people talk about stuff like encephalopathy, that's a delirious person. So a lot of times people who've not even presented to the ER, they're confused, they're dizzy, loss of taste, loss of smell. These are some of the things that you may get even before you present. Now, there are people that are talking about you take, who is it, Tylenol, Advil, something to treat your fever. Now, if you have a fever of unknown origin and you don't know where that fever is coming from, you need to call your doctor. I think one thing that's happening in our brown and black communities is that we're waiting too long to reach out for help. So we're at home taking cod liver oil, we're at home putting the red onion up under the bed, we're at home putting stuff in the bed to take the fever out, but this is a different type of fever. So The first thing is that I hope that those of you that are listening, if you don't have a thermometer in your house, you need to purchase one. One thing that was happening with my patients, and I'm a psychiatrist, is many of them didn't even have a thermometer. So they had to order a thermometer, Dr. Mary, and it took 2 to 3 weeks, because when the disease first began to go rampant around April, everybody needed a thermometer. So now there are a lot of them are available, but we need to be sure that there is one. The hand touch doesn't work anymore, because if it goes above a certain number, you need to call your doctor. Don't wait 2 and 3 days in what they call self-quarantine. Be careful with that concept, because the self-quarantine is leading a lot of people into full-blown acute respiratory distress syndrome, and that's leading to pneumonia. And by the time we go to pneumonia, we go into the ventilator, and from there, some of the what we call adverse outcomes are not nice. So if you're not feeling well, if you think it's a sinus infection, in 2019, it probably was. But a sinus infection in 2020 is a different index of suspicion. Why? Because COVID-19 grows in the sinus cavities. So a lot of people, their initial presentation was a sinus infection that wouldn't go away because the disease was constantly multiplying. So they would treat the sinus infection, they would treat the fever, it would go away, but then the fever would come back. So from a behavioral health standpoint, we see a lot of anxiety, a lot of depression. We see dizziness. We see a big one that I'm now seeing is I'm seeing post-traumatic stress disorder. And I imagine that as the time progresses, and next year this time it's going to be probably a whole new phenomena, because as people began to get better, they began to remember the illness.
I trust that you're being blessed by this discussion on tonight, the COVID conversations. Just wanted to take a moment and encourage you to sow into the ground of the Life Church. As you see on tonight, that yes, we do kingdom work, but we also are interested and we invest in the lives of our people, every aspect of our lives. We say that we are learning to live our best lives, and that means we have to address every part of who we are. We are spirits, we live in bodies, and we have souls. And so we trust and we try to take care of every aspect of our being. And so I want to give you the awesome opportunity to sow into the ground of Life Church. Yes, you have that opportunity to sow into good ground. It's good because this ground produces. It's good because seed placed into this ground is not wasted seed, but it is seed that produces tremendous harvest. And you too, tonight, even as you release your seed, I want you to expect God to do as he promised, to return it in good measure, pressed down, shaken together, and running over. Don't expect this to come back the way that you release it, but expect it to come back in greater measure. There's several ways that you can give on tonight. You can go to our website. That's www.lifechurchatlanta.org. Again, www.lifechurchatlanta.org. You can give via Cash App, and that Cash App address is Life Church Atlanta. Life Church Atlanta. Or you can text and give by texting Life Text to Give. Life Text the number 2 give to the number 71441. Whatever way you choose to give on tonight, that is fine. But whatever you do, be sure to place a seed into this good ground. God bless you. And now let's return back to our conversation.
We're also seeing people being laid off. People can't go to check on mom. There are people whose mothers are in nursing homes and they have not been able to go to see their mom. People who go to normal worship services. Some people don't have a computer to zoom in and see the worship services, so they've been without worship services for 6 months. That's devastating for a person that went to church every month. There are people now who are we're getting a lot of domestic violence. I'm having a lot of I almost want to do a course on how to break up effectively, because it's so many people now that are having problems in the home with relationships, because there are people that have been married for 20 years that realize they don't really like each other. but now because you're forced in that situation, and then they become aggressive. So now it's hands-on. There are a lot of people who understand they have sexual dysfunction. So there are a number of manifestations that are happening in the home. Then we have the substance abuse issue. There are people who've done very well. Dr. Merritt, they have been clean from cannabis, clean from alcohol, 2-year chip, 3-year chips. They are now becoming vulnerable. So I had a case today, and I know he said, I do pills. He said, I do the opioids. And I said, when the last time you used? He said, I'll be honest with you, I used before I got on the phone. There's nothing I can do about it, but, just do the eval. And there are people who will come, and he says, what happens is, he say, I appreciate you because you're the only doctor that looked. Because when you look, you can see now you have the availability to check to see how many doctors that person has seen. He's seen 4 doctors. And he was able to get the opioids and the benzodiazepines from 4 different doctors. So there's a lot. Substance abuse has now increased. Depression, anxiety, and trauma, they're becoming almost mainstays. I used to, when the pandemic started in March, I would see not many patients, but invariably now I see 2 to 3 patients. I call them, they're laying in the bed. I said, what's wrong? Oh, I'm COVID positive. I went to the leather club last weekend. Oh, that wasn't a good idea. So people, I have a student ready to go back to Spelman. Quarantine, professional parents. Mom went to the grocery store. Both of them are now ill. Followed all the rules, all the regulations, but she can't go to school because she's positive. And she's had 2 positive tests. So that's another issue. Another issue that we're finding is there are people that are getting negative tests 2 times, and the 3rd test comes back positive. By that time, you had the full manifestation of the disease, but because you didn't take the action, there's been progression forward to pneumonia. And then there's one dreaded thing that we have to always consider is pulmonary embolism. That's one of the other monsters. So when you look at the news, you hear of the adverse outcomes. Now, the good news is 80% of the people recover. The other news is we have about, I say 87% of people recover, but then there are some adverse outcomes. But we have to know now, it used to be where the people on the older people, more immunocompromised people were having positivity rates were up, but now the positivity rate is now moving down because a lot of the young people they're still having parties. They're not social distancing, and they refuse to wear masks. So the behavioral health aspect has now intertwined into the primary medical aspect. So we are seeing a lot of very, very ill patients. And as a result, Dr. Merritt, some jobs will give you maybe 3 weeks. And the 4th week, some of them may terminate you. There's not a clause for continued stay because of COVID. Some jobs are asking people to return to work. Some jobs are okay with you being out to January with the caveat that you can work from home. But there are certain types of jobs where if you don't have the time, they are dismissing you. So there's the economic part, which leads to depression. There's the social distancing part, which is leading to some depression. And there's just the fear of death and dying. And that's the very critical one, that a lot of people are very afraid of dying. So they don't go get tested, because if they get tested, they are afraid that they will die. And that's just not, that's one of the...
And how they die.
And how they die. So they don't go to the hospital because the rumor is if you go to the hospital, you get on a ventilator and you die. And that's just not true.
The impact psychologically on healthcare workers who are seeing this day in and day out, this level of morbidity and mortality that they probably have never seen in their careers before. have we even thought about the effect that that's going to have on them a year from now, or even now?
I did the provider that is, I never thought about this, but the anesthesiologist, I never thought about the impact that this had on the anesthesiologist, because like I did a forum. It was me, an anesthesiologist, a police chief, and I was like, why would they not get a PCP or an internist? And I realized, Nurse Yvette, that the anesthesiologist is the one that does the intubation. So the anesthesiologist, Dr. Merritt, is the physician specialist that comes the closest in contact with the most of the viral load. So when I was on with this anesthesia, she was from South Carolina somewhere, her anxiety, her agitation, you could just see it. And she was clearly traumatized. Now, I practice from my downstairs, totally free, and I get my sandwich and a couple of cookies, and I'm cool. And I can talk about your depression, whatever you want to talk about. And I'm free, and I can change clothes in the garage if I want to, but I have not been exposed to anybody. But if you work in the hospital and you have children, you have parents, you have to almost disrobe before you come into your house. You have to take a shower, you have to wash your hair. There's this very grueling process that you've been doing for the past 6 months. And then you can't even hug your mom or maybe touch your child because you are afraid of giving them the disease. Because you know that that last patient you saw, and sometime when the COVID, the virus has produced mucus. And they say that it's heavy and it's copious when it comes out of the patients. And so when you see that and you come home, there's just a fear with the healthcare providers. We've lost a lot of nurses. We've lost a lot of doctors. The AJC actually published, I think it was this Saturday, the number of nurses and the number of doctors that we've lost. They're keeping it kind of hush-hush, because if we really knew the real numbers, I think everybody would just stay home. And so they're keeping some things kind of hush-hush, because if you think about it, the number of people ill and dying from COVID-19 is exponentially more now than in March and April when we actually did the shutdown. But because of the leadership of our great nation, they will prefer to have economics over healthy lives. So what they've done is they've closed the mouth of the CDC and some of the agencies that would give us the information because they don't want to cause panic. But it's very, very serious. And those healthcare providers, I've had some healthcare providers that they get COVID. One, I had a nurse that I treat, doing very well. And he was treating a patient, and when they did the handoff communication, the nurse did not tell him that this patient was COVID positive. So all of the staff that worked with that patient, guess what? They became COVID positive. And there was nothing they could do, because that's what we do as healthcare providers. We're on the front line and we're at risk. But the problem is some people that get infected come out. There's a small proportion of people that don't come out, and that's the fear with the actual healthcare providers. So a lot of them go to work every day with fear for their lives.
As devastating as those numbers that I quoted at the beginning, again, those numbers are not real numbers. The real numbers would really terrorize us if we knew them. Every city, every state are counting and reporting patients differently. How we are recording the number of deaths associated with COVID. There are people who die in their homes who have never been tested, but they had COVID. And in many places, those persons are not counted as COVID deaths. People who die with comorbidities. In certain more politicized areas, those death certificates, they will go with one of the other morbidities versus COVID intentionally to keep the numbers down. And to your point, the numbers they're giving us are horrifying enough, but just to imagine that those numbers are far from real. And again, the fact that our communities, Black and brown communities, are being affected by this more than other communities. It was very interesting that there was such urgency nationally to do something about it and to protect our citizens until a certain data was released. I don't think we would have ever shut down if they knew from the beginning that this was affecting Black and brown people more than others. When we shut down, they thought everybody was at similar risk. But after the information came out that Black and brown people were more affected, then everybody started talking about reopening the cities. Reopening the cities. There was an urgency, almost as if, I don't want to say that they delighted in the fact, but they sure weren't concerned with the fact that our communities were being affected more so than others. One other point, and we're going to start talking to our survivors and letting them tell their experience. The other thing that's interesting is that for many of us, we did quarantine, but everybody wasn't given the privilege of quarantine, and we call them essential workers. We know healthcare providers, Dr. Owens was talking, the nurses and the physicians, those working in the hospitals, we think of them as essential workers. But we got to think of all the other folk who are also essential workers, like working in the grocery store and all of these. And they didn't get the privilege of quarantine, and they are compensated like almost they're working for wages that they can't even live off of. So you're putting your life at risk every day to get an income that you can barely survive off of to make everybody else safe. And so just to Dr. Owens' point, what impact does that have on you, that you see everybody else locked down at home and you got to get up, you got family, you got kids, you got a life that you want to protect also, but you got to get up and you got to go to work. And every time you step out of your house, you're putting your life in danger, and you're not even being compensated. Not for the degree of the risk that you're taking and the service that you're providing. What effect does that have on someone psychologically?
I think that really was one of the pieces when we talk about healthcare disparities and understanding why people of color are being more affected by the disease. One of the issues is that a lot of people of color don't have insurance. And so that is a problem. A lot of people of color don't have insurance. And the government gave $1,200 and people were excited, but they probably should have given emergency insurance. Because when you go to, if you had, during the time of COVID, March, April, May, June, most of the insurers waived copays. But if you didn't have insurance, you didn't have access to us. And if you were at a certain level, as far as the poverty level, you could get emergency Medicaid. But there's a large number of people, Dr. Merritt, who are people of color who work, or working class people, that don't have insurance. So you definitely not gonna go get a bill from the emergency room, and you definitely probably won't call an ambulance if you start getting shortness of breath. So what you do is you'll die at home. So that was one of the things that happened in some of the other major cities, that they found people that were dying at home because they never went to the doctor, they never went to the hospital, because it is expensive to go to see a provider, to go to some of the care agencies. But we have to know that the disparity that you see with a lot of minorities is that a number of minorities don't have insurance and they don't have access to care. So what is happening is, and there's also a fear of doctors, especially with the African American male, and that dates back to the Tuskegee experiment. And a lot of us don't like going to the doctors. Guilty, but I go. So a lot of people don't like to go for different reasons. So if you even look on Facebook and they talk about a vaccine, a lot of people, I'm not taking a vaccine. You might want to reconsider. I'm not taking the flu shot. You might want to reconsider because the bugs that are moving nowadays are a little bit different. So those workers that were bus drivers, housekeepers that had to go, they had a lot of anxiety, and some of them even quit their jobs because the anxiety became so overwhelming. I became a little freer with the benzodiazepines during this period because I didn't do a lot of Xanax, but people had real anxiety. So I became a little less stringent because people were really having some issues. And there was some essential workers who were making I had no idea that the minimum wage was $7.25 in Georgia. I had no idea. That was the minimum wage.
How do you live off of $7.25? That is a crime. That is what we call 21st century slavery. That is 21st century slavery. And unfortunately, the people who make that work the hardest. That is 21st century slavery. To all my lifers, pastors say, go get the flu vaccine. Go get your flu vaccine. Don't listen to Leroy or Shaquanda. Go get your flu vaccine. Go get your flu vaccine. If you show up in the emergency room with the symptoms of the flu, they will treat you like you have COVID. You will be treated like you have COVID until they can prove otherwise. You do not want to get the flu this year. And God forbid you end up with the flu and COVID at the same time. Go get your flu vaccine. I can't tell you to go get your COVID-19 vaccine because there is none, but there is a flu vaccine. Go and get your flu vaccine. Type it in the comment section. Pastor, I've already gotten it. I got mine. If you haven't, I'm going to get my flu vaccine. Thank you so much for tuning in tonight. You've just listened to the first part of this conversation, COVID Conversations. Next week, you definitely don't want to miss. Next week, we're going to have an opportunity to listen to the individual experiences of COVID survivors. We're not going to tell their experience. They're going to tell their own experience. You don't want to miss this. If you've been viewing tonight and you've never given your life to Jesus Christ, this is most important. It's even more important than your health because these bodies, no matter how good we take care of them, they will eventually decay. We are not promised that we will be able to live in these bodies forever. These bodies are breaking down every day. We have to make preparation in this life for our next life. And we do that by embracing Jesus Christ. He came so that we might have life. Hear me tonight. He died, gave his life that we might live. Not just live in these bodies, in this earth, but that we might live eternally. That once we are saved, we receive the gift of eternal life, meaning that we live forever. So even when these bodies break down and cease to survive, we continue to live with our Savior in his presence. And I want to offer you this precious gift that's been made available to everyone, not just to church people, but to everyone. The Bible said God so loved the world, and that includes you. He was thinking about you. He loves you, and he wants to come in relationship with you. And the only thing that separates that and prevents that from happening is you. new. He is waiting on you to receive him as your Savior. And if you do that tonight, my promise to you, I can only promise it because he promised it. If you receive him, he will save you tonight. I'm going to pray. I'm going to ask that you pray along with me. And as you pray this prayer, say these words and mean them with your heart. He's going to come into your life and your life will begin brand new on tonight. Come on, pray with me. Dear Lord Jesus, I believe that you're the Son of God. I believe that you came to earth, that you lived and you died. You died on the cross. You shed your blood. They buried you. For 3 days, you remained in the grave. But on the third day, God raised you from the dead. And tonight, you are alive forevermore. Jesus, I believe this, and I receive you as my Lord and as my Savior. Thank you, Lord, for forgiving me of all of my sins. Thank you, Lord, for saving me. Come on, declare this with me right now. I'm saved. Come on, declare it with me again. Right now, I'm saved. And yes, that is the truth right now. You're saved. I want to welcome you into the family of God, and I also want to extend to you the privilege of being able to come and unite your life to the Life Church. And you can simply do that tonight, yes, right where you are, by simply texting Life Church to the number 31996. Again, just text Life Church to the number 31996. Follow the prompts, place the information that's requested, and you will become a part of the Life Church, and someone will be reaching out to you, welcoming you to life. There are others of you who've been watching tonight. You are already saved, but you are not connected to another ministry. I want to give you the privilege of being able to connect your life to a place where you can grow, you can be stretched, and you can reach your potential in God. That place is the Life Church. You too can become a part of this ministry by texting Life Church to the number 31996. Come on, text Life Church to 31996. You too, follow the prompts, place the information that's asked, and yes, you too tonight will be a part of this great ministry, the Life Church. Someone will be in touch with you, welcoming you also to life. Again, thank you for joining us on tonight. Again, don't forget, next Wednesday night, you don't want to miss part 2. Stay connected with us throughout the rest of this week. Join us on this Sunday morning at 9 a.m. 9 a.m. for our Sunday school hour. Several classes that are available. You can connect with those classes via Zoom or via Facebook. That information is before you right now. And then at 10 a.m. on this Sunday, we will reconvene for our Sunday morning online worship service. You don't want to miss this Sunday. I'm going to be concluding the message, all these things are not against us. That message has been a blessing to so many. It has blessed me even as I've ministered. You don't want to miss this message on this Sunday, 10 a.m. Join us for our Sunday morning virtual worship experience. God bless you. Have a tremendous rest of this week, and we'll see you right back here at the Life Church. God bless you, and good night.